Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And today we're going to talk about something that's been apparent by your interest because the news media has been talking about it, and they should be talking more completely about it. And it's about the Zika problem, which is something we want to talk about because it's potentially a major health catastrophe if we don't talk about it and have some knowledge about it. So I have two experts here. First, and you've seen her a number of times already. I've seen you 3 times on television recently. Dr. Marie Florent-Carre, who is the Associate Professor for Family Medicine and Public Health in the College of Osteopathic Medicine here at Nova Southeastern. Welcome.
Thank you.
Good to have you back.
Thanks for having me.
Good. And a doctor, PhD doctor, an associate professor of microbiology in our College of Medical Sciences, Dr. Bindu Mai.
Yes.
Welcome.
Thank you. Thank you for having me.
Thank you for being here. We recently had a federal conference here to focus in on the Zika problem. And we're going to tell the people what that problem is. So we'll start with you, Dr. Florent-Carre, and tell us what is the problem relative to Zika virus.
Well, the Zika virus was first identified in the 1940s, 1947, in Uganda. And at the time, this is a virus that was found and identified in the monkey and not really infecting humans in terms of infection. Over several decades, I would say from the 1940s to 2007, it has been reported sporadic 14 naturally occurring cases that were reported in humans. And most recently, in 2007, there was an outbreak that my colleague Dr. Bindu can expand on, but in terms of the Micronesia, Yap Island, there was an outbreak there where 70% of the population was affected. So it's definitely imminent that we pay more attention because now we have mosquitoes infecting humans, and the mosquito is the vector and it's from the family of flaviviruses, specifically the Zika or Aegypti. Aedes aegypti is particularly the mosquito amongst the flaviviruses that is transmitting this virus from human, mosquito biting the human and infecting us with this virus.
Dr. May, so we know, or the people might not know, that it has migrated from Micronesia across the Pacific into dominantly the southern portion of the Americas. And now it has become a major issue, particularly in certain countries in South America.
Right.
And it's of tremendous interest to us because we're an import. We receive many, many people who come to us through our airports and ports, right, dominantly in the state of Florida, in the state of New York, and places in Texas. So tell the people what the issue is. How did it get there, and why are we having a problem now?
I will. So since it was first identified in 1947, 60 years later, we had just a handful of cases, less than 20 cases. In 2007, it hit Yap Island, affected 70% of the population. And the issue seems to be it was a susceptible population. That means they had never been exposed to Zika before. That's an island where we hadn't seen dengue or chikungunya before. So in 2007, majority of the population got affected, and that seemed to be the incident, febrile illness. From there, 2013, 2014, it affected a bunch of islands in the Pacific Ocean. So in the 7 years, it spread to the Pacific, and from the Pacific, now it's spread to all of continental South America, Central America, the Caribbean, Mexico. When we talk about Caribbean, it also includes one of our territories, Puerto Rico. So the issue is what's happened in these 7 years to have caused this tremendous increase in numbers. And the answer seems to be a susceptible pool of individuals. So in Africa, and also, so in the past we saw this percolating in Asian countries and also in African countries, and there seemed to have been a certain background level of exposure to the virus. So people were exposed, maybe they had some measure of immunity, and so they had asymptomatic, maybe mild illness, so it never really caused an issue. So there are two main lineages of this virus. One is the African strain, the African lineage, and the other one is the Asian lineage. So the one that was subsequently imported to the Pacific seems to be an Asian lineage, and it seems to have come either from a traveler or importation of mosquitoes. We don't quite know, but there seems to be strong suggestion that during the World Cup in Brazil, then it subsequently got transferred from an Asian visitor to South America. So the numbers that we are seeing seem to be because this virus is now affecting a susceptible population. That means they hadn't ever seen it before. So now there's no herd immunity against this virus. So perhaps in a few years we won't see quite this alarming number of cases, or cases of microcephaly or Guillain-Barre. We don't know. Only time will tell. But there has been a lot of studies being done to look at all possible ways that it can adversely impact the human population, including fetal development.
Well, that's the issue that finally brought it to the mass media in this nation.
Right.
Mm-hmm.
It's not something that has not been around for, as you say, for really long periods of time. But the infection of a population dominantly in the South American continent, and then of course, and Dr. Florent-Carre, you spoke brilliantly about this, about how the public now has become aware dominantly because of fetal changes and microencephaly. So we want to explain to the folks what's happening to the fetus and what's happening?
Yeah, so the cases that are reported, and if I take the numbers that we have currently as of June 8th of this year, in the United States, there has been a total of 691 traveler-associated Zika virus infection. And out of that 600 plus that has been reported, 80% of the patients that have been exposed to the Zika virus through traveling, having been bitten from a mosquito, getting infected, returning to the United States, those are the cases that we're dealing with. There's a percentage, so the virus is transmitted through blood, and it's been found in semen, and this is where the sexually transmissions have been reported. To date, there have been 11 cases of sexually transmitted Zika infection. Therefore, the virus is found in the semen, and pregnant women are susceptible, or women of reproductive age are susceptible to getting the Zika infection. In the adult, the symptoms that we see most commonly are fever, a maculopapular rash, which is small bumps, small red bumps in the face, the upper extremities, which usually resolves within a week. You get arthralgias, which are joint pain, muscle ache. Those are your most common symptoms that present with this infection. And these symptoms are usually resolved within a week. When we started having cases where a disproportionate number of babies were being born with birth defects, and what they mean by microcephaly is that the virus goes through the placenta to the fetus and is attacking the development of the brain cells of an infant. And the skull collapses because the brain is not really developing like it should. These women are usually, in terms of diagnosis, would be after the first trimester. Those are the cases that are being reported, is that a traveler who has come in with these symptoms, so 2 or more symptoms, need to be tested. A male patient, as well as all women, including pregnant women, need to be tested returning from traveling to the countries that have Zika activity in order for us to be able to diagnose the Zika infection and thus monitor the pregnancy in order to have better monitoring.
Well, again, I bring to your attention the fact that really, even though this has been around since the 1940s and it's been, traveling around the world, the focus now is on the United States of America, because especially Florida, because Florida has, I think, if not mistaken, the greatest number of reported cases.
Yes,
correct?
so far 147 cases, not counting the
Right.
pregnant women.
But
38 pregnant women.
This
are.
is sort of like a firecracker that's ready to explode.
Right. I think prevention is key, and Dr. Florent-Carre mentioned the ways in which we can transmit. Sexual transmission is one, so awareness, educating the public. If you have traveled, because a lot of cruise liners had decreased their prices, so a lot of travelers have gone outside to endemic areas, and then they're returning. And when they return, it's very important for us to make them aware of how they can potentially, maybe even if they're asymptomatic, but definitely if they're symptomatic, that they could potentially transmit this to someone who's of reproductive age and then potentially have an adverse effect on the fetus. So sexual transmission is key, and also blood-borne. How do we handle blood donors who may have gone abroad and then potentially are carrying this virus? So the Red Cross they have a very good policy where they give a questionnaire to any potential blood donors to see if there has been recent travel. And they ask them either to self-defer or they will defer them for at least 4 weeks. There are certain criteria, very set criteria. And then even if they have donated blood and they turn around and in 2 weeks become symptomatic for Zika virus, then they're asked to please contact the Red Cross so that they can not use that for their purposes. So I think education is key. I think we really have to make the public aware of what are the adverse effects, long-term consequences of this virus, right? The majority of individuals, it is asymptomatic. Okay, no big deal. If you or I get it, maybe it's not a big deal, but then there is a certain high percent of Guillain-Barre syndrome where the body's own immune system attacks itself, and that can be potentially, it could lead to paralysis. The majority of those cases are reversible, but that's an adverse effect. We should make the public aware, because then they can put a lot of focus on putting prevention into place, where you're doing everything possible so that the mosquitoes are not biting you, because it is mosquito-borne primarily.
With reference to this this conference that was held with CDC officials, FDA officials, HHS officials, all the groups that are involved with trying to protect the health and safety of our public, we had this, I guess you could say, a round table. And one of the things that really, and you just hit on it, one of the things that people don't realize is that the mosquitoes that bite the Zika carrier moves on to bite maybe 2 or 3 other people, because it was interesting to listen to the director of the Mosquito Control from the Monroe County that was saying that it takes 4 to 5 bites.
In terms of we have to monitor in terms of mosquito control, looking at eliminating mosquitoes or preventing mosquito bites from outdoor and indoor. The Aedes aegypti is an avid biter, a daytime biter, but they also can survive indoor. Even in a small cup of bottled water, the mosquito can lay eggs, and these eggs, they tend to attach to the containers of the walk of the container of the particular, let's say it's a bucket of water that is just standing in the backyard. You could have an old tire that is containing water. You need to get rid of old tires, many buckets of water, maybe a pool that's not treated, that is just standing water where mosquitoes can lay eggs and attach to the walls, and once the water covers the eggs, they hatch, and within a week you have adult female mosquitoes that then can go on and infect. We have not yet had a locally acquired infection from the mosquito. However, mainly through traveling. This is the time, the summertime, the temperature is ideal for these mosquitoes to multiply. And we definitely need to be aware. What I would tell the public is to protect themselves by having the Environmental Protective Agency has mosquito repellents, that there are ingredients that have been shown to be safe and effective, even in pregnant or breastfeeding, based on the studies they've done. So it includes ingredients like DEET, picaridin, the lemon or eucalyptus. So some of the ingredients, you need to read the labels and the instructions on how to spray yourself. What the general public may or may not be aware of is that when you spray yourself, because we say to spray your extremities or wear long sleeve shirt and wear long pants, you can even treat the clothing with permethrin. So permethrin is a product that you do not put on your skin, but it is on the clothing. The other mosquito repellent, there's a time frame that it's no longer effective. So you need to read the labels and continuously spray because there's a particular strength of the ingredients where it will not last all day.
And these products are available in most
in most of the department stores, yes.
Publix or
Home Depot
or Walgreens or
yes.
CVS or independent pharmacies. They're all over the place.
Yes.
Right? So people should be due diligent and make sure that they and their children are protected, because
Correct.
this is not only an adult problem,
Right.
it could be for the child. And knowledge is the biggest weapon we have to fighting a potential disaster, because we have the temperate climates, we are the import for the ships and the airplanes that come in all the time from these venues where Zika is prevalent. Correct?
Right, right. And if you look even at just the vector alone, both Aedes aegypti and Aedes albopictus are considered to be the main vectors for Zika transmission. All over the southeastern United States, we are in that range where these mosquitoes may be found and may, if we don't do our due diligence, may show local transmission of Zika. So I think not just the public health officials, but even the public, once we make them aware, and even open containers, let's say there's standing water in that. Not only once a week you empty it, but then you're supposed to scrub it. That way you get rid of any eggs that are attached. So just emptying the container won't get rid of the eggs. So you have to scrub it and then either keep it covered or toss it. And these could include buckets, any containers, old tires, little swimming pools, bird baths, whatever.
Well, I even heard the reference at the conference of a little kids' toys.
Yes.
Or outside a little kid's truck or whatever it is. I mean, that's the idea. And the reason why I think I'm trying to bring this information to our viewing public is because what I heard was really something which was very important and almost near frightening, because you don't want to have a situation where you have, I mean, I was focused on Guillain-Barre at the point in time many years ago when we had that flu relationship, which was a virus as well. Yeah. But it was really bad. It was really bad. And this could be dramatically disastrous for the formation of children. And we just can prevent so much of this if people would start to pay attention to it. I'm not in any way, trying to petition the people to have to listen to what you're saying. I'm trying to tell the folks that we do have a crisis, which is, we got so excited about Ebola. I happened to say this at the conference. I remember when everybody got so excited about a particular person who they thought had contact with Ebola virus, who was riding her bike in Maine, in a city, and they didn't want her to ride a bike, and they didn't want her to be near anyone or whatever. But meanwhile, we have not a dissimilar situation with Zika virus. I mean, true, Dr.
I'm glad you mentioned Ebola. I think that also there's a perception that is associated with the severity of illness and disease. Patients in general come to our clinic as a primary care physician, usually when they're sick, even though we do promote prevention. I wear the public health hat as well, and we have our preventive visits, our annual well woman visits. But a lot of patients usually present to a physician with symptoms. And what's alarming here is we have patients that have a viral load of the Zika virus that are not displaying symptoms, but yet may transmit it to a woman who then gets pregnant, or there's male-to-male transmission that has been reported as well. And so therefore, they're definitely, I almost look at it as quote unquote a human now being the vector because of this group that is asymptomatic, and we don't know the length of time in which the virus is active in the semen. In the serum, the test that we do is called a reverse transcriptase PCR. What it is a test that really looks for active infection. And the CDC is it has developed a test for blood as well as urine. There's urine testing that also looks for active infection that we can detect up to 2 weeks. The physicians also need to have a high index of suspicion. If we don't, I have the opportunity at Nova Southeastern University College of Osteopathic Medicine to teach residents and medical students. And when you take a history from a patient, fever is very common. We have symptom part of the Zika infection that is a retroorbital pain. That's pain behind your eyes. That comes with sinusitis. Someone can have allergies and present with pain behind their eyes, a fever, a rash. Those are common symptoms. We as practitioners need to have a high index of suspicion. So in general, in addition to educating the public and raising awareness, the physicians also need to be educated and up to date as to how to identify, how do we get that information from our patients so that we could have collaborate with the county health departments to have better surveillance.
Well, and again, the reason we're having this show is not in any way, manner, shape, or form to frighten the public.
And I think as a lay person, you can take the responsibility by preventing mosquito bites, regardless of whether you've been diagnosed as having Zika infection. Especially if you've been diagnosed, the CDC recommends that for 3 weeks you don't get bitten by any mosquitoes, because chances are then they could potentially pick up viral load from you and then pass it on. And the other thing is, as a person who hasn't been infected, you want to keep that status. So mosquito prevention, not getting bitten by mosquitoes, is absolutely critical.
Well, we're down. I'm sorry, we're down to the last few minutes of the show, but I want to. You made a good point, Dr. Florent-Carre, and that is that we do the testing, but I think the general medical community has to recognize the fact that these tests, which are not dramatic relative to the intrusion into your body and otherwise, it's just having it done. So I would assume that, I know when they come to our primary care clinics, wellness clinics here, the tests are done, correct?
We have access to commercial labs now.
Right.
That the commercial labs have the test accessible. Whereas prior, we would only report where the health department and the CDC was doing the testing. Right. Now it's getting a little bit more widely available, insurance coverage, and the CDC also put on their website, as well as the county health departments, that if a patient is uninsured, that we then can refer for this testing directly by the county health departments. So there is insurance coverage for the serum and the urine test. Further testing such as placenta, fetal cortex, amniotic fluid, and placenta, other more specific testing, including antibody tests. Because if you've traveled and you've presenting now after a week or 2 weeks of having the symptoms, then you recommend antibody testing. If a pregnant woman has been exposed to, let's say, their partner who have traveled and who has symptoms, there's antibody testing that's done on all women, whether they have symptoms or not, on pregnant women.
We're down to the last 40 seconds of this show. So I just wanted the folks to know that are viewing that Dr. Bindu Mai and Dr. Marie Florent-Carre are experts in this field, and they are advocates for prevention, and they're advocates for knowledge. So that's why I had them on the show. It's not my words that says that we have a potential health disaster. It's CDC. It's the people who are health officials that are reaching out to you to have more knowledge. So I want to thank both of you for being here today. Dr. Bindu Mai, Associate Professor of Microbiology in our College of Medical Sciences, and Dr. Marie Florent-Carre, Doctor of Osteopathic Medicine, Master's of Public Health, who is also Associate Professor of Family Medicine. And you have been a magnificent spokesperson on this issue, and I hope that people reach out to both of you because, folks, all we're trying to do is just try to give you some knowledge, and we're telling you to, in essence, understand that Zika is here, and it's not. You can alter the elements of the so-called health crisis if you make yourself knowledgeable. And I'm glad that both of you were here today. Again, if you have any questions, just there's an email address right here and a telephone number. Just give us a call. We'll try to get the answers for you. And just start asking questions and start buying those mosquito repellents. It's important, and make sure that there's no standing water around your homes. Remember, this show is your show, and I always tell you to take good care of yourself, but now I'm going to ask you to be a little due diligent and check around and see whether you have any standing water around your homes, and make sure that you cover up, and particularly little kids too. So they don't know, you know. So moms, dads, grandmas, grandpas, etc. Take care of those little kids. This show is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.